We're ready to get started whenever you are.
Good morning, everyone. It is 11:03, and I call the meeting of the Tuesday, December 17th, 2024 Committee of the Legislative Regulation Review Committee to order. Would my co-chair like to make any welcoming remarks?
Just this will be the last time that myself and Chairman Dathan will be running the meetings because this is the last meeting of this session term. And so I just want to state for the record that it was a wonderful 2 years co-chairing this committee with my good co-chair and the ranking members. And it's a fabulous committee. We have some of the greatest staff in the building. Want to thank them all as well. And Merry Christmas, Happy Hanukkah, Happy Kwanzaa, and Happy Holidays. Thank you.
Thank you very much. I echo my good co-chair's comments, and I will also add that it's been an absolute pleasure to work with him for the last 2 years and hope he can carry on in the future. Would my ranking members like to say anything today? I think you're on Zoom. Don't think they're here, actually. I'm sure they'll be joining. There's a busy time of the year. With that, Madam Administrator, could you please administer a quorum call?
Representative Dathan,
Present.
Senator Kissel, Representative Carpino, Senator Maroney, Representative Claire DeStitria, Representative Arnone, Representative Godfrey,
Here.
Senator Hartley, Senator Kelly,
Senator Kelly is here.
Representative McGordy,
Present.
Senator Austin,
Present.
Representative Ryan, Representative Fishbein,
I am here.
and Senator Ciccarella. All right, we have a quorum. Thank you.
Wonderful. Thank you, Madam Administrator. With that, let's begin today's business. For first thing on our agenda, we have the Regulation 2024-026 from the Department of Public Health, Nursing Home Staff Ratios. I would entertain a motion to accept the LCO recommendation of approval in whole with technical corrections.
So move.
So moved by Representative Godfrey. Do we have a second?
Second.
Thank you, Senator Kelly, for the second. Motion's made. Is there any discussion? I think there's a few bits of discussion here. I'm going to call my co-chair first.
Thank you very much, Chairman Dathan. This regulation was before us several months ago, and there was a concern that was raised regarding the fiscal impact. And if you look at the impact to the Department of Public Health, it's relatively modest, but the department that actually is on the hook for paying for the additional staffing if they're required to fulfill the ratio requirements in this regulation at nursing homes, that's a substantial amount of money, and that would have to be paid by the Department of Social Services. I've been informed by my staff. I haven't had a chance to review this in great detail, but it's my concern at this time if that issue has or has not been addressed. And if the overall impact of this regulation on the state's finances, budget, is not addressed in this proposed regulation, then I'm going to be compelled to vote no today. Because I don't think that we should allow regulations to go through unless their total impact on the budget is addressed at this stage. And so I don't know if there's anyone here from the Department of Social Services that can address that issue.
Thank you, Senator Kissel. We have social DSS coming up. If you could please address that. it does say in the fiscal note from OFA that the DSS costs is $380,000 annually. But we have an understanding that there might be follow-on costs coming through Medicaid, and we need to understand if DSS is going to be paying the increased Medicaid cost. So if you could please identify yourself and talk to the committee.
Sure. Good morning. My name is Nicole Godburn. I'm the fiscal manager for reimbursement and certificate of need for DSS for the Medicaid agency. We are the primary payer for nursing homes. Medicaid on average covers about 70% of the revenue for nursing homes. So this, of course, is very important to us. We took a look at this, and the fiscal impact and the analysis we did was we looked at the cost reporting for nursing homes. Nursing homes are annually required to submit cost reports to us, and from those cost reports, we're able to calculate out their annual rates that are paid to nursing homes under the Medicaid program. And the cost reports also show the impact of staffing and what they're paying for staffing to the various categories of staff that work in nursing homes, anywhere from housekeeping to nurses to CNAs. So taking a deep dive into that and working with the Office of Fiscal Analysis, we were able to discern that there's roughly about 4 nursing homes that currently do not meet the social worker aspect of the regulation changes, and about 24 nursing homes that would not meet the aspect of the changes to the CNA licensure of the regulations. So looking at that, we discerned that the actual impact, there would be a very minimal impact. And Representative Dathan, as you mentioned, that impact would, we're projecting would cost us about $290,000 in gross, but the state share, because we get federal match in the Medicaid program, that would reduce it to about $145,000 for one aspect of it. And then the social worker piece. So in total, you're looking at approximately $470,000, which would be about $235,000 for state share. And that is, we feel, very minimal impact to us.
Thank you very much. I'm going to open it up to my committee here. First, my good coach.
Yeah, I want to follow up on that. I'm having a hard time getting my mind wrapped around this. This is supposed to have a dramatic impact on ratios. And if it does, I find it very hard to understand how that impact is just in a few hundreds of thousands of dollars. To me, if nursing homes have to hire new people, there's substantial costs with that, even if there's federal reimbursement of 70%. And I'm just wondering, is it just, I mean, did you get down to how many people actually were going to have to be hired by the nursing homes to meet these ratio requirements?
Yes, we looked at that because in most nursing homes are currently meeting this particular standard. And I can defer to my colleagues at DPH since they directly monitor who's working in the buildings. But from the cost reporting and the analysis we did, most of the nursing homes are already meeting this standard. And as I mentioned, there would be about 24 nursing homes that would need to hire for CNA level and about 4 nursing homes that would need to hire for social worker level. And in total, we have about 196 nursing homes in the state. So given that there would be a small percentage of homes that would need to hire to meet this, because the majority are currently already meeting this standard, that's where we discerned that the fiscal impact would be minimal.
All right, I appreciate the indulgence of Chairman Dathan. I appreciate your answers. It's surprising to me because the way this was described to me several months ago when it first came up was that the impact to the DSS side would be in the millions of dollars, and now it's far different than that. But you drill down, you're testifying here before us, and so I appreciate that, and I'm happy to listen to further discussions, but that goes a long way to addressing my concerns. So thank you very much.
Thank you. Just to follow on, I do understand you said 470,000. If we have 28 nursing homes that don't have either a social worker or CNA, if you were to say, okay, what's the annualized cost for one person? Let's say they were just short one, that would get an average salary of $16,780. That is sub minimum wage. for those work. So I'm just trying to understand how the numbers sort of build up.
Sure. No, I appreciate that question. So when you're looking at the hours that they report out per those various categories on the cost report, it may be that a home, for example, would need to hire a part-time worker, a per diem, or maybe increase hours for a current part-time worker to meet the requirement. So there could be various combinations of how the home would need to hire to achieve the ratio. It wouldn't necessarily mean that they're having to go out and hire a straight FTE to meet that. It just may mean they have current staff that they need to increase those ratios.
So a fractional sort of
Yes.
person or additional hours. Okay. I'm going to continue to listen to the discussion. I know the good co-chair of appropriations, Senator Austin, has a question.
Thank you very much. I have a couple of questions. One, we're talking about social workers and certified nurses attendants or assistants. Uh, are these people available for these positions? Number one, do you know?
I apologize. I would not know. I would probably have to defer to my colleagues at DPH since they do the licensing for those professionals. So I unfortunately don't know.
Is there somebody that can answer that question that is here? And don't go anywhere because I have specific financial questions for you. No, we are all used to those chairs. We apologize for them snapping up at you. Sometimes I think they want to grab the person that's trying to get up.
Good morning, Senator Austin. So we
You have to
have,
identify yourself for the
oh,
record.
yes, sorry. I'm Barbara Cass. I'm the Senior Advisor to the Commissioner of DPH for Long-Term Care. Good morning, Representative Dathan. Good morning, Senator Arnone. Good morning, Senator Austin. So your question was relative to
Senator Kissel.
Senator Kissel. Sorry. Your question was related to access to the workforce.
Yes.
And what I thought I heard was as it relates to certified nursing assistants.
And social workers, because those are the two positions that they have called out in this particular regulation.
So social workers, we have not been identifying during the course of our survey activities. Survey activities include licensure renewals, recertifications, complaint investigations. We have not identified any issues at DPH related to inadequate numbers for social workers. For nursing assistants, we know that there were great efforts during COVID to increase access to nurse aid training. Coming out of COVID, we increased the number of training programs exponentially. Not only are nurse aid training programs being done at the community college level, but I would say probably we increased the number of nurse aid training programs done in nursing homes by 100%. We had a very robust approval program. We had an individual who was visiting the sites. So there is much greater access now than there was in 2020, 2021. We have identified some issues with staffing. In the last quarter, we have done 161 surveys. That includes complaint surveys and recertification surveys. Of that total 161, we've identified 11 issues with staffing. It could either be related to an issue with a nurse or a nursing assistant. I also want to underscore, though, that for the most part, we are identifying compliance with staffing. When we do any activity at DPH, we look at 3 weeks of staffing, 2 weeks retrospectively and 1 week prospectively. And when we do cite issues, it's usually that one-off. It's one day where they didn't have enough staffing and there may have been delays in care. But for the most part, we are seeing compliance. Last night, we also looked at Nursing Home Compare, and I looked at nursing homes that have a 1-star rating. And again, this was not a scientific review, but in the 1-star homes, which for those of you who are not familiar with Nursing Home Compare, that's a designation for the nursing homes that are the greatest challenge, or in some cases could be poor performers. And we found in that data that they were meeting the 3.0 staffing. So it wasn't a problem even for the 1-star homes.
And what is the average if you know, what is the average pay hourly rate for nursing assistants?
I would not have access to that information, but what I can tell you, it varies depending on the home. We have approximately 60 to 70 nursing homes that are connected to a collective bargaining. So those rates are higher than our smaller nursing homes. There was a lot of work done in the last couple of years to have the average nursing home salary. It was a little under $20, but I am not an expert on that. That's all anecdotal information.
And do you, while you have not done a survey on social workers, do you have information on social workers relative to starting pay or hourly rate of pay?
I do not have access to that information, but I do want to clarify, if I may, that we do look at social services and social workers during the course of our survey activities. Not only do the federal regulations speak to the responsibilities of that service, but the regulations of the Connecticut state agencies do as well.
And you indicated that those that are involved in a collective bargaining environment pay more than those that are not.
That's what I've heard anecdotally.
Okay, so I guess you're encouraging those others to become involved in a collective bargaining
No.
environment?
No,
Just wondering.
no.
Thank you. So I want to go back to the, if I may, Madam Chair, to the financial aspects of this. In the statute, it requires that Medicaid that expenses related to Medicaid are paid out through DSS. Would you say that that's a fair statement?
Yes, DSS is the single state Medicaid agency, so yes, we would pay all Medicaid reimbursement.
And if a nursing home came to you and said, our Medicaid expenses have gone beyond that $470,000 expense, we're up to $4 million. Would you, by the very nature of the law, be required to pay that?
Not necessarily. We have statute in place under 17B 340 that is our regulation that and statute that oversees nursing home reimbursement. In there is phrasing that says if there is a state or federal mandate for a nursing home that increases costs by 0.5%, then we would do an analysis and reimburse the nursing home for that. So there's a threshold that must be met first. And if nursing home came to us and said that very statement to us, we would have to do a deep dive. We would have to look into costs. We would request quite a bit of documentation from them and do a large analysis to see if they met the threshold in the statute. And if they did, then we would adjust the rate accordingly.
So if they had, I just want to go to this exact analysis. So most nursing homes do not have a huge profit margin in them. Would that be fair?
It depends on the home. I would say it depends.
Okay. Thank you for that. Because I look at nursing homes as in particular, those that receive the predominance of their funding through Medicaid as being on the lower end of the profit margin versus private pay.
We don't unfortunately have data on private pay because we have no eyes, for lack of a better phrase, into private pay facilities. We can just speak to those that give us data, and those would be, and that's actually the majority of the industry. Again, that's about 196 homes. And in Connecticut, I believe there's 15 or so private pay buildings, and we would just have no visibility into those.
And if we looked at the private pays on the starred rating of them, I think that we see the private pays as having higher starred rating, generally speaking.
I would have to defer to DPH on quality.
I am reluctant to say affirmatively that's correct, but they are not the 1 and 2 star buildings.
Correct, because the 1 and 2 starred buildings are your predominantly more Medicaid and predominantly receive most of their funding from the state or federal government, and predominantly are paying less in wages to the workers there. So, you know, at least from my analysis of looking at it, and when I look at the starred ratings, the higher starred ratings are those that are private paid, receiving more dollars, able to pay their workers more, able to be a little bit more stable in regards to workforce because they're paying more and can provide more services. Back to the review that you would conduct on the finances of this. So we have finances relative to what we're paying. I would say most of the requests for Medicaid have to do with reimbursements for personnel. Would that be true?
Of the best way to look at it, of the Medicaid dollar that's spent, about 51 to 52% of that is on, yes, direct care. So your RNs, your direct care staff. The remaining portion of the dollar would be on the various items that we also reimburse for example, infrastructure of the buildings, housekeeping, food, all the rest of what it takes to run a nursing home. That's also very important. But yes, about 51 to 52% is direct care.
And we've gone back and forth on direct care, whether registered nurses are into the direct care. Do you count registered nurses as direct care?
Yes, that is direct care, yes.
So a registered nurse who is working as and meeting the definition of a direct care worker. I want to carve out leadership. So a
Right.
director of nurses, for example, would not be included in the definition of a direct care worker unless they were actually assuming assignment that aligned with direct care duties and are still have filled their duties as the director of nurses. The director of nurses role is defined in the regulations and it must be full-time. And they do administrative functions. But if there was an issue or an incident where the director of nurses had to support care and needed to count that into the staffing pattern, they would have to demonstrate that indeed that director of nurses was providing direct care services.
So this goes back to the same question we had last time, was the direct care. And we were told that registered nurses were not to be accounted for in direct care. That registered nurses, generally speaking, are filling leadership roles and overseeing the rest of staffing. And I can see that we are going to require these 1- and 2-star nursing homes to come forward with and to justify the usage of someone into a direct care position, which would ultimately cause an increase in Medicaid of what they would seek in a Medicaid reimbursement, which is where we are here. So when we're looking at Medicaid reimbursement, which Senator Kissel and Representative Dathan talked a bit about, that reimbursement rate is depending on who we are allowing to be counted into the staffing ratios. And I certainly believe in the staffing ratios. I really do. But I want to make sure that we're going to pay the nursing homes what they deserve to be paid. And my concern is that we are making it impossible for some of the nursing homes that are on the lower performing sides of things to get reimbursed at a rate which will allow them to become a higher performing nursing home. I am concerned that in particular, when we are looking at the reimbursement rates in the Medicaid, when a nursing home has a higher percentage of Medicaid, not private pay clientele, that we are providing them the not enough to make sure that we're taking care of those that are on the lower socioeconomics of the, uh, of the world? Are we going to say that private pay people deserve better care, and we're at this lower end, and we're going to give them a hard time about reimbursement. We're going to give them a hard time about staffing, where they're paying lower levels for um, uh, their CNAs and social workers and even registered nurses. And we're going to say, um, you know, you don't, uh, you need to provide us more detail on reimbursement rates. And I think you should um, be detail oriented on what they're going to get. But I am very concerned that what we're doing is making it harder for lower income nursing homes and lower performing nursing homes.
Senator, I appreciate those comments. We in the department, I think, shared that concern, which is why we transitioned to an acuity reimbursement system several years ago. And that system is fully operational as of July 1st this year. We did a 3-year phase-in of that system because acuity reimbursement specifically targets exactly what you just spoke to. So we adjust the Medicaid rates every quarter for nursing homes. And that quarterly adjustment is designed to meet the acuity level of the residents in that building. There's federal reporting that nursing homes need to do to CMS, and we extract that federal reporting and calculate case mix index numbers for nursing homes. And the greater the number every quarter, that means that that particular nursing homes has a higher acute, more resource intensive residents in their building. Hence, they would have to staff up to meet those resources. So our reimbursement system throttles every single quarter to meet that very thing that you're talking about, to make sure that they are staffing appropriately to the level of care that the residents in that particular building need. So we do that every single quarter to meet that level. And touching on the DPH regs, when we looked at it, we noticed in particular for the RN, for the nursing level, the nursing homes are meeting that level currently. Where we found where they were not meeting the level when it comes to the regulation is that CNA level. And that's those 4 homes that we identified that would need to do staffing up on the CNA portion of things. But when it came in our analysis to the nursing aspect, we found that they were at that level. But Barbara, I know you wanted to comment as well.
So Senator Austin, I just want to make sure that I didn't misrepresent myself. And RNs, LPNs, and nursing assistants, it's all 3 are included in the total nursing staff for direct care workers. We do carve out registered nurses separately when we do our calculations. There are many registered nurses that are assuming direct care duties in all 197 of our nursing homes. And as Nicole has mentioned, we seldom find that there is a shortage or an inadequate number of registered nurses. It's that CNA, and again, it's one-offs. So I just wanted to be clear that so that you understand that we do count LPNs, RNs, and CNAs in that total number of 3.0. And that was a change that we made in May of this year. We heard the industry, we heard the legislature that we needed to go back and look at that. And we made that adjustment. So the registered nurse who's working on the unit, the LPN, licensed practical nurse who's working on the unit, is calculated into that 3.0.
Thank you for that. And my last question, because I don't want to monopolize um, the questioning, should we lose Medicaid dollars from the federal government, which is something that we're all hearing about? Would the law require, because when we talk about the dollars, the statute doesn't say you're guaranteed to get so much, 50% of this or 70% of this from the federal government. The statute says that if they are Medicaid funding necessary, that DSS will fund that. And you can ask all the questions you want of that, but at the end of the day, if they can prove their case, Medicaid funding is something that is governed by what you have to pay. Would we be required to pay it even if we did not get 70% from the federal government?
would like to preface, I am not a lawyer. So I think the question that you're asking is one that we as a department are having those internal discussions. I think anytime there's any change in presidential administration, we do an analysis. What would be the incoming administration's desire? What does that mean to the program? So I know we as a department are doing that look. There's lots of conversations that are happening, I think, so that we can roadmap out and plan around any potential changes. So we are, I know, internally having those discussions. But again, to your very question, I am not a lawyer, so I unfortunately would not be able to answer that.
Thank you for that. And I'm not saying that this administration, this incoming administration is different than any other administration. When they come in, they all have their own
Correct.
policies that they believe in and that they are going to put forth. We are talking specifically about Medicaid, and by public statements, Medicaid seems to be the area where some focus will be on funding. Whatever that may happen to end up being, it's hard to figure out right now, but that is something that we're all paying attention to, because the Medicaid line item in our budget is a large line item. You cover a lot of things, a lot of services for a lot of people come out of that line item, and nursing homes is only one of many. So I still have some concerns. I'll pay attention as we go through. Thank you, Madam Chair.
Thank you very much. And I know my good co-chair of appropriations talked about the amount of Medicaid we saw in the FAR report last week, that we are 250 million over in Medicaid compared to our budget. So this is an active discussion. But I do want to offer Representative Fishbein also wanted to speak.
Thank you, Madam Chair. I'll be brief. You know, it's very unique us sitting here today looking at this regulation. We are a unique committee. I doubt that many of our colleagues know what we're looking at today. But this, I think, is an example of an area, a law. The regulation is a law that should be dealt with by the full legislature. You know, anytime we are impacting, and I agree that, you know, the numbers started on this, we originally heard millions. And now we're down to, you know, a fraction of that. And perhaps the fraction is based upon the ceiling that we've heard about here today, that at the end of the day, DSS doesn't have to reimburse the nursing homes at 100%, but there is a cap to that. So perhaps, you know, that is part of that calculation, which, you know, opens up another area of inquiry. Because if we as a government mandate the staffing ratios, which I support, you know, the staffing ratios, I support that there should be something. You would have thought that this would have been done voluntarily by the industry, you know, but sometimes government has to get involved. But at the end of the day, this is a reimbursement, which means the money's already gone out the door. So if we are requiring certain payment, and through minimum wage and things like that, we are saying it's got to be at a certain level, at least as a floor. But at the end of the day, the nursing home is not getting 100% reimbursement. Then you're going to have nursing homes going out of business. And that is the last thing that I want to be blamed for, this very small committee of the entire legislature. And that's, I think, the impact really should be dealt with by the full body. And I see no reason why it can't, actually. So that's all I wanted to say. Thank you, Madam Chair.
Thank you, Representative. Are there any other comments out there? Seeing none, I'm going to ask Representative Godfrey if he'd like to withdraw his motion for approval in whole with technical corrections.
Fine with me. Thank you, Madam Chairman. I withdraw it.
Senator Kelly?
Yes, I'll withdraw my second.
Thank you very much. With that, we are going to entertain a motion to reject without prejudice so we can carry on these discussions and continue this so that we can make sure that we don't adversely hurt our nursing homes. As folks have mentioned, our initial fiscal note for this, I think, was 40 million. And then we've kind of change the numbers a bit. So I do think that there is additional work that needs to be done so that we can make sure that we are keeping our nursing homes in good order, making sure that our aged community is getting the care it needs and deserves, but also ensuring that our nursing homes are able to provide such services. So is there a motion to accept, or sorry, excuse me, is there a motion to reject without prejudice?
So moved, Madam Chairman.
Okay, we've got
Second.
moved by Representative Fishbein, second by Senator Kissel. Is there any further discussion on this regulation? Senator Kissel.
I just want to thank you, Chairman Dathan, for the shift of gears right now. Clearly, I think it's the cake isn't baked yet, and when there's a discrepancy rather of 40 million versus 400,000, I think just taking a little bit of a pause and going back to the drawing board. And I think Senator Austin raised some interesting points. If I'm a nursing home and I can now take someone who's a registered nurse, who's the head of a department or one of the managers, and then assign her a couple patients, and now she's part of the ratio or he's part of the ratio, so there's a lot of moving pieces here. And I think ultimately, not only do we want the best patient care possible here in the state of Connecticut, but we also want to make sure that we have economic viability of all of our nursing homes. And so we have to juggle all of that. And it probably behooves us to take a little bit of a pause as we do have a shift in administrations and seeing how this is going to shake out. So this is not a vote no, it's just a back to the drawing board for a little bit of a pause. And I strongly support the actions taken by my good co-chair, Chairman Dathan. Thank you.
Thank you very much. Any other discussion? Seeing none, Madam Administrator, could you please call the roll?
For proposed regulation 2024-026 from the Department of Public Health regarding nursing home staff ratios, we're voting on a motion to reject the regulation without prejudice. Representative Dathan.
Yes.
Senator Kissel. Representative Carpino. Senator Maroney.
Senator Maroney votes yes.
Representative Arnone. Senator Ciccarella. Representative Fishbein. Representative Godfrey.
Representative Godfrey votes yes.
Senator Hartley. Senator Kelly.
Senator Kelly votes yes.
Representative Claire Distretria. Senator Austin. Sorry,
Senator Austin votes in the affirmative.
Thank you. Sorry, Representative McGorty
Representative McGorty votes yes.
and Representative Ryan.
Representative Ryan votes yes.
Thank you.
Great. With that, we are going to move on to the next regulation. Thank you, DSS and DPH, for speaking out today. It's important to be here in person. We appreciate that as a committee. Next, we have the regulation 2024-27, which is excuse me. Yeah, that's right. The Department of Social Services alternative payment methodologies. I would entertain a motion to accept the LCO recommendation of rejection without prejudice.
So moved.
So moved.
Moved by Senator Kissel, second by Representative Fishbein. With that, is there any discussion? Seeing none, Madam Administrator, would you please call the roll?
For proposed regulation 2024-027 from the Department of Social Services regarding alternative payment methodologies, we're entertaining a motion to accept the LCO recommendation of rejection without prejudice. Representative Dathan. Senator Kissel. Representative Carpino. Senator Maroney.
Senator Maroney votes yes.
Representative Arnone. Senator Ciccarella. Representative Fishbein. Representative Godfrey,
Representative Godfrey votes yes.
Senator Hartley, Senator Kelly,
Senator Kelly votes yes.
Representative Claire DeStitria, Representative McGorty,
Representative McGorty votes yes.
Senator Austin,
Senator Austin votes in the affirmative.
Representative Ryan.
Representative Ryan votes yes.
Thank you.
Thank you, Madam Administrator. Next, we're going to continue to leave the votes open for the remaining part of the meeting. But next, we have the Regulation 2024-028 from the Department of Public Health, Blood Collection Facilities. I would entertain a motion to accept the LCO recommendation of rejection without prejudice.
So move.
Moved by Senator Kissel, second by Representative Godfrey. With that, is there any discussion? Senator Kissel.
Thank you very much, Chairman Dathan. I know this is a motion to reject without prejudice, so it's going to go back to the drawing board so that the LCO concerns can be addressed. But there also was an issue that had arisen regarding the substance of the proposed regulation regarding a requirement for 2 years of experience for the head of the, that's not for this one. All right, I've been corrected by the co-chair. Thank you very much. Scratch that.
You can talk on the next one. Thank you very much. Is there any other discussion? Seeing none, Madam Administrator, would you please call the roll?
For proposed regulation 2024-028 from the Department of Public Health regarding blood collection facilities, we are entertaining a motion to accept the LCO recommendation of rejection without prejudice. Representative Dathan,
Yes.
Senator Kissel, Representative Carpino, Senator Maroney,
Senator Maroney votes yes.
Representative Arnone, Senator Ciccarella, Representative Fishbein, Representative Godfrey,
Representative Godfrey votes yes.
Senator Hartley, Senator Kelly,
Senator Kelly votes yes.
Representative Claire DeStitria, Representative McGorty,
Representative McGorty votes yes.
Senator Austin,
Senator Austin votes in the affirmative.
Representative Ryan.
Representative Ryan votes.
Thank you.
Thank you very much. Again, we're going to keep the votes open. Next, we are going to have Regulation 2024-029 from the Department of Public Health, Source Plasma Donation Centers. I know there's been a lot of discussion about this one, and but I'd like to entertain a motion to accept the LCO recommendation of rejection without prejudice. Moved by Representative or Senator Kissel, second by Representative Fishbein. Is there any discussion, my good co-chair?
Thank you, Chairman Dathan, and I appreciate you correcting me recently. It's not the first time, nor will it be the last time that I speak without knowing what I'm talking about. But on this one, in the proposed regulations, while it's being rejected without prejudice by concerns raised by our crack team of attorneys in LCO, there also was a substantive issue that had been discussed with myself, my co-chair, and met representatives of the industry. And it's a new industry to Connecticut, and it's a little different in that the plasma comes out of you just like blood, but they don't take the red blood cells. It's pretty much all the other things that are in there. And but then it goes back into your system with some saline to keep you hydrated. So it's a little different than donating blood, but similar. That being said, one of the requirements of the proposed regulations is a requirement that these facilities have a director that has 2 years of experience. And even though it's my understanding that this kind of industry or service or gathering of plasma is going on throughout the country in various stages, I've been told that it'd be a real burden to try to get folks in this new novel area in Connecticut with automatically 2 years of experience, because you just don't have a well of people with experience right now. And that makes total sense to me. I think there's plenty of internal business reasons why they would want highly qualified individuals supervising this facility, this procedures, not the least of which is the ever present threat of a lawsuit necessitating insurance and everything else. So I will say this, whether I'm lucky enough or not to be back on the Regulations Review Committee in the next legislative session, if I am here, I will look to the issue as to the Department of Public Health, and I understand their concerns, but I think it's a bridge too far to require this new industry to have that requirement in there, and I'm looking that they can take it out. I know that they've worked really, really hard back and forth in negotiating this regulation. It was originally put forward to model the federal regulation, and if Connecticut wants to be stricter, that's well within its rights. But in this particular instance, I just don't want to hobble something new getting out of the gate here in our state that could prove to be very helpful to people's health and welfare going forward. Thank you, Madam Chair.
Thank you very much. And as my good co-chair said, this regulation did go above what the federal standards are for the source plasma donation centers. And I think that was some of the substances concern as well. Is there any other discussion? Seeing none, Madam Administrator, would you please call the roll?
For proposed regulation 2024-029 from Department of Public Health regarding source plasma donation centers, we are entertaining a motion to accept the LCO recommendation of rejection without prejudice. Representative Dathan.
Yes.
Senator Kissel. Representative Carpino. Senator Maroney.
Yes.
Representative Arnone. Senator Chicarola. Representative Fishbein. Representative Godfrey.
Representative Godfrey votes yes.
Senator Hartley. Senator Kelly.
Senator Kelly votes yes.
Representative Claire DeStitria. Representative McGordy.
Representative McGordy votes yes.
Senator Austin.
Senator Austin votes in the affirmative.
Representative Ryan.
Representative Ryan votes yes.
Thank you.
Thank you very much, Madam Administrator. Next, we're going to move on to our resubmittals. The first one on our list is Regulation 2024-020A, the Department of Consumer Protection's real estate licenses. I'd like to entertain a motion to accept the LCO recommendation of approval in whole with technical corrections. Moved by Senator Kissel, second by Representative Fishbein. Is there any discussion? Seeing none, Madam Administrator, could you please call the roll?
For proposed regulation 2024-020A from Department of Consumer Protection regarding real estate licensees, we are entertaining a motion to accept the LCO recommendation of approval in whole with technical corrections. Representative Dathan.
Yes.
Senator Kissel. Representative Carpino. Senator Maroney.
Yes.
Representative Arnone. Senator Chicarola. Representative Fishbein. Representative Godfrey.
Representative Godfrey votes yes.
Senator Hartley. Senator Kelly.
Senator Kelly votes yes.
Representative Claire DeStitria. Representative McGordy.
Representative McGordy votes yes.
Senator Austin.
Senator Austin votes in the affirmative.
Representative Ryan.
Representative Ryan votes.
Thank you.
Great, thank you. We're going to continue to keep the votes open, Madam Administrator. And we have our last regulation here of the legislative session. We have Regulation 2024-022A from the Department of Consumer Protection, Emergency and Hormonal Contraceptions. I would entertain a motion to accept the LCO recommendation of approval in whole with technical corrections.
So moved.
Moved by Senator Kissel. Second by Senator Austin. With that, I'd like to have a little discussion. As part of the regulation, the information described in section 20-633K-6 is not subject to FOIA, whether it was through a pharmacy or DCP. But I did want to ask for a motion to adjust the regulation to approve and hold with technical corrections, but delete the subsection 20, section B of section 20-633K6.
So,
Can we
Madam Admin,
amend the,
do we have to take back our motions and seconds on this? Because
I believe it's a strike of a subsection, so I think we can adjust LCO.
I think we have to start.
It'd probably be cleaner to withdraw the first motion.
Exactly.
just
Okay.
Restate it.
Okay.
I'll
Senator
take back my
Kissel,
second.
Senator Austin, would you like to remove your?
Madam Chair, I will withdraw my motion.
As will I withdraw my second.
Okay. So the new motion I'm asking for is to approve in whole with technical corrections, except for to strike subsection B of section 20-633K6. Do we have a motion to approve that way? Senator Kissel?
Second.
Second by Senator Austin. Is there any discussion on this? I'd like to open it up to Senator Austin.
Thank you very much. So this resubmittal, I think, has a couple of different problems with it that I'm hoping removing that section will deal with. When you first came on, Madam Chair, you said that this is not subjected to FOIA. I would like to ask a DCP representative a couple of questions, if you don't mind.
Sure. Prepare yourselves, DCP. And please identify yourselves before you speak.
CJ Strand, Legislative Director for DCP.
Thank you, Madam Chair. So a couple questions. It looks like we're modifying this that would remove section B that would not require a pharmacy to forward the information within 24 hours of an emergency contraception being dispensed. But for any form that comes out of a pharmacy up to the Department of Consumer Protection, are there specific repositories for those forms? Do they send up a simple email? Is there a form that is used? How does that happen?
So I believe those would be, the screening documents would be maintained the same way any other record within the pharmacy is maintained. And if I'm understanding the question correctly, it would still be protected by HIPAA. But I believe we have Rod Marriott from the department as well, our Director of Drug Control, who may be able to speak a little more clearly to this.
Sure.
So you're talking about the screening
Please
forms and how they
identify
would,
yourself, sir.
my apologies. I'm Roderick Marriott. I'm the Director of the Department of Consumer Protection's Drug Control Division. So I just want to make sure I follow your question properly and answer it accurately. Your question is, where are the forms maintained that are provided in the screening documents or records that are sent into the prescription drug monitoring program?
I'm most concerned about the records that are sent to you relative to whatever form is necessary to be filled out on anything that you would get from a pharmacy Is there a person it goes to? Is there a division it goes to? And how do we handle the information that you get?
Sure. So we wouldn't get these screening forms unless there was an investigation into the way a screening was performed, or perhaps an allegation of an error or something along those lines. And that would be maintained by an investigator and would stay in the department's file, and be kind of protected in that file, and then redacted as necessary if a proceeding was going to go forward in an administrative way. As for the records that are uploaded into the prescription drug monitoring program, they're uploaded to a database that is maintained with our vendor, and then kind of searched depending on the searcher, right? So if it's a medical practitioner or a pharmacy, those records are searched and reviewed, and then a decision is made. If it's part of an investigation involving the department or other criminal justice facility, those would be searched and used as a reference for a case, not necessarily solely for a case purpose.
And this, you have an outside vendor that holds all of the information that's sent up to you?
Correct.
And
If I could just add, Senator, so I think some of that with the vendor is speaking to subsection B, which was just deleted. I think we were covering all tracks in that answer, but I think specific to your question originally was on the screening documents, which again are not provided to us unless there's an investigation.
And so by removing this one section, we don't have to worry about any of this, that you're not collecting this data, so we don't have to worry about where it may go.
Yeah, no, there's no data automatically transmitted to DCP. Again, the screening documents are for the care of the patient and maintained by the pharmacy. We would only access them if we're doing an investigation. There'd have to be a complaint first. And then as Rod mentioned, there would be a lot of protections there with redacting as necessary. And separate from that, the automatic transmission was from subsection B with the prescription drug monitoring program, which did create some, beyond being foiable, was or not foiable, also created some concerns with this would be having pharmacists report the hormonal or emergency contraceptives to the PDMP, but if a physician did it, they wouldn't. So it was creating some inconsistency there and a difficulty for the pharmacies.
I think I have additional questions that may be relative to current law on how we're handling data that you get from pharmacies.
Mm-hmm.
My understanding is that we'll remove what I consider a section that needs to be removed, because I don't think we have the capacity for pharmacies to handle it. And I am still concerned about data that is received by DCP or an outside vendor or anyone when pharmacies are forwarding that information to DCP. My concerns are relative to who gets to see that information, and my concerns are relative to whether or not that information would ever be released to anybody, redacted or not. I am concerned that we are gathering far too much individual data on people that I don't think it's necessary for the government to be involved in, personally. So I'm happy to see that we're removing the 24-hour requirement, which is my understanding here. But I am concerned broadly about how much data is being sent up to DCP on individual people. Thank you, Madam Chair.
Thank you very much. Is there any other discussion on this regulation? Seeing none, Madam Administrator.
Excuse me.
Excuse me. I'm so sorry.
Sorry, Madam
Minute,
Chair.
please.
I couldn't find the hand.
I have to apologize. My computer battery ran out as well. And so I couldn't see you wave. But that works very well, Senator. So please carry on.
Okay, so just following up on what Senator Austin was just talking about. In subsection B, we're striking that because it requires a shall transmit within 48 or 24 hours. In subsection D, there's also a transmittal, a little different, but still along the same lines in that the information, the records, shall be readily retrievable and provided to the department upon request within 48 hours. And again, I think what the statute had talked about was making these records available for inspection, but not disclosed upon request. And they're totally two different things. One is the pharmacist making the records available if DCP wants to come down and investigate. The other is an affirmative. The pharmacist is going to transfer records to Hartford, to DCP. And I think that's going a little bit beyond what the statute had indicated. So I would need some sort of, or want to see some sort of, I'm going to say, limitation on D, that the department just can't request, because what's to stop DCP from just instituting B as a policy and requiring all pharmacists upon their request to give them the information in 48 hours? So I think there needs to be some condition precedent that the department needs to do in order to get the information.
Thank you, Senator. Mr. Strand?
Yeah, thank you. D is really there for our investigative abilities, and this is not a subsection that would be utilized just to get information. It would always be stemming from a complaint or an investigative need. I apologize. And really, I think it is consistent with a lot of our investigative needs. So I would request that we still have the ability to access that information as needed with an investigation.
And I do understand that we, as part of our current statutes, we actually have a indication there. I'm going to ask LCO just to comment on that, please.
So Senator Kelly is correct. The statute requires the pharmacy on request from the department to make such screening documents available to the department for inspection, but doesn't contain a deadline to do so. The statute authorizes the commissioner to adopt regulations. The commissioner in this instance used that authority to add a deadline. It's questionable whether this is an outright conflict, but Senator Kelly is correct. The statute is written differently. There isn't a deadline.
Thank you. Senator Kelly?
Yeah, I mean, if we're going to amend on B, and the department is only using this for the purpose of investigative information, then can we condition D that the information's only provided upon complaint and initiation of an investigation before, it's disclosed?
I just wanted to add in here that we are not able in this committee to add language, but I'm going to have my co-chair speak next.
Thank you, Madam Chair. Yeah, that's exactly what I was going to say as well. So I see that the good senator wants to add a condition precedent to this regulation, but we are not, as a committee, allowed to add language. We can always strike language. And I defer to our LCO staff if my understanding is correct. And so if we were going to try to address this, I don't know how we could do it right now on the fly through you.
Nick Bombase, LCO. No, you can't. You can only delete. You can't change or add conditions.
Thank you very much. Senator, do you have any other points you'd like to talk before we pass on to the next person who would like to talk?
No, thank you.
Okay, thank you very much, Senator. Next, we have Representative Fishbein.
Thank you, Madam Chair. Just to take this a step further, what kind of investigation would be involved in the mandatory disclosure?
Anything that is not in compliance with the statute or the regulations. So maybe prescribing without having taken the training, or if the screening documents weren't completed properly, or just any number of concerns related to any activity under this language.
So I guess ordinarily, if one has a potential dispute and is seeking documents, they could file with the court what's known as a bill of discovery to get those documents. So that avenue is available. The other concern that I have is what notice is there under the regulation to the actual receiver of the product that their information is going to be disclosed?
I'm sorry, can you repeat that question?
Sure. A complaint is made by someone, and DCP says, or DPH says to the pharmacy, you need to disclose this information because the regulation says so. I didn't see a portion of the regulation that requires notice to the patient that that information is going to be provided.
I think this and all of this language is our standard language for investigations, and this would, I'll defer to Rod if there's any additional notice, but I think as a licensee of the Department of Consumer Protection, this is within our authority to investigate complaints brought against our licensees and ensuring that the statutes are properly followed. Rod, I don't know if you want to weigh in. Is there any specific disclosure to patients? I know there's HIPAA requirements when setting up relationships with the pharmacist. Any other?
Thank you. Should I introduce myself again or just can proceed? This is, well, I'll just.
You might as well.
This is Rod Marriott with the Department of Consumer Protection, Director of Drug Control Division. So generally, the requirement would be on the pharmacy, I believe, to disclose that information. I would imagine the majority of our complaints in this area would be generally by the patient themselves, saying that perhaps substandard care was provided by the pharmacist, and that is what we would be investigating. But it's kind of a general standard language for us and a standard process for us for any prescription error, no matter where, no matter what kind of medication it is.
No, I recognize that, and rarely does language, I mean, we don't have the initiative to recognize regulation language that we want to have changed. The department comes to us. So this may be the very first time that this area has been looked at, but certainly the power that's given to the department through the regulation isn't just dealing with that particular incident. The department could, have a complaint against a pharmacist and believe, perhaps in good faith, that this bad action is more rampant, and just blanket ask the pharmacist to disclose all prescriptions that you have issued, that you have filled within let's say a year. That isn't necessarily, I mean, there's no preclusion in this regulation. So now I've got a bunch of patients that their information is going to DCP and or DPH, and I don't see any protections for the individual in here. So I just wanted to recognize that. So thank you, Madam Chair.
Thank you very much. Is there any further discussion? Seeing none, Madam Administrator, would you please call the roll?
For proposed regulation 2024-022A from the Department of Consumer Protection regarding emergency and hormonal contraceptives, we are entertaining a motion to approve the proposed regulation in whole with technical corrections with the deletion of subsection B of section 20-633- or sorry, K-6. Representative Dathan.
Yes.
Senator Kissel. Representative Carpino. Senator Maroney. Senator Maroney. Representative Arnone. Senator Ciccarella.
Senator Ciccarella votes yes.
Representative Fishbein.
No.
Representative Godfrey.
Representative Godfrey votes yes.
Senator Hartley. Senator Kelly.
Senator Kelly votes no.
Representative Claire DeStitria. Representative McGordy. Senator Austin.
Senator Austin votes in the affirmative.
Representative Ryan.
Votes yes.
Cat,
Oh, Senator Maroney.
I apologize. Able to mute myself on time. Senator Maroney votes yes.
Thank you very much. This concludes our business for today on the agenda. Madam Administrator, can you please check to make sure no one missed any votes? I think there might be a couple out there.
Senator Ciccarella missed several, if we could. Okay. For proposed regulation 2024-026 regarding nursing home staff ratios, the vote was for rejection without prejudice. For, excuse me, proposed regulation 2024-027 for Department of Social Services regarding alternative payment methodologies, the motion was rejection without prejudice. For proposed regulation 2024-028 from Department of Public Health regarding blood collection facilities, the motion was for rejection without prejudice. For proposed regulation 2024-029 regarding source plasma donation centers, the motion was for rejection without prejudice. And for 2024-02A from Department of Consumer Protection regarding real estate licensees, the motion was for approval in whole with technical corrections. Thank you.
Wonderful. Is there anybody else on the Zoom that may have missed votes, Madam Administrator?
No, we're all set.
Awesome. Our administrator's going to hopefully have a wonderful Christmas. Thank you for all your hard work for the last 2 years. You've been absolutely amazing, and so glad for everything you do. I also wanted to take this opportunity to thank the folks over at LCO. You have really been wonderful in the last 2 years, and we really appreciate all your work. Same with OFA, who have really worked so hard in the last 2 years for us. I do hope everyone has a wonderful Christmas, wonderful holiday season, Kwanzaa, Hanukkah, winter solstice, whatever you celebrate. I hope it's a wonderful time, and Happy New Year to all. I'm going to ask my good co-chair if he'd like to say any final remarks.
Well, as Luther Crank said in Christmas with the Cranks, that goes double for me. Thank you. Happy holidays, everyone. Merry Christmas.
Wonderful. What about my ranking members? Senator Maroney, are you like to say anything final for the committee?
Just to echo and double on your
Seeing
plus
none, I
one
think-
to your thanks to all of the staff and the CAT, and then also to follow up on Senator Kissel, wishing everyone happy holidays. That goes and double down on that as well. So thank you very much. Happy holidays. Look forward to seeing everyone with the new session in the new year.
Wonderful. Thank you so much. I'm going to entertain a motion to adjourn. Moved by Senator Kissel, second by Second by Senator Austin. Thank you very much. Moved in second. All in favor? Aye. Happy holidays and see you next year.